calves are something which not a lot of people pay attention to. But for some people, especially who are bodybuilders or let's say who just want to look better, calves become a very important focal point for their whole aesthetic appeal. And these days, because of that reason, calf implants are becoming very popular. Hello, I'm Dr. Arjun Handa, plastic surgeon at Handa Aesthetics. So calf is an area of the body where usually hypertrophy is very difficult to achieve. So when you talk to a person who is a very ardent gym goer and believes in developing his body to the aesthetic ideal, then calf hypertrophy becomes a very important focal point. And some people are genetically not blessed because they work out a lot, they exercise a lot, and even then their calves remain thin. And the proportion with respect to the thighs and upper body is just not there. So in these kind of patients, we either do two kind of procedures. One is fat grafting and the other one is implants. Now implants has the advantage of providing the exact shape and size that the patient desires. The good part about this procedure is that it is done under spinal anesthesia. That means it's a form of local or a regional anesthesia. And the recovery is fast. The incision is extremely small, which is in the knee crease, so it's not visible at all. The implants are placed just under the fascia or a lining in the leg, which does not cause any bleeding or any complications. The muscles remain intact and the recovery is fast. Now, who is the ideal patient who should get this procedure done? The patient who gets this procedure done should understand that calf implants are only going to look good if the rest of the body is in proportion to the one that we are giving to the calf. If you are overall lean and skinny, then it doesn't make sense to have big calves. But on the other hand, if you have big thighs and you just find it difficult to get the hypertrophy in the calf muscles, then calf implants can greatly improve the overall aesthetic ideal. The apprehension among this population is that it's going to affect the muscle contraction or their way of walking or somehow the overall muscle performance. Well, because I said that the implants are put under a lining or a fascia and over the muscle, the implants do not impact the muscle function at all. They do not cause any weakening, they do not cause any disturbance with running, walking, or doing anything that you want. So it's a quick, safe, effective procedure to improve the shape of the calves.